The olfactory nerve. The olfactory nerve is involved in your sensation of smell. It works with other parts of the brain to give an emotional response to smells, as well as integrating smells with memory. This is a sensory nerve, and it can be examined using a small sample of a common fragrance and placing it under one nostril at a time while occluding the other.
All right, can I get you to close both of your eyes, please? Awesome. Can you plug one nostril for me? All right, and then just go ahead and inhale for me. What do you smell?
Coffee.
Great. And eyes still closed, and plug the other nostril. Smell for me. What do you smell?
Honey.
Yes. Great job.
Cranial nerve 2, the optic nerve. The optic nerve transmits information to the occipital lobe and is translated into visual information. This is a sensory nerve. This can be tested by having the patient close one eye and maintain the gaze on the examiner's nose. The examiner starts with an object outside of the visual field and asks the patient to identify when they see the object. Another way to test this is have the patient cover one eye while the examiner covers their eye. The examiner holds up 1 to 3 fingers in each of the 4 visual fields.
So what I want you to do is you're going to stare at my nose, okay? Cover up one of your eyeballs, alright? Closer to you. Alright, now what I want you to do is whenever you see this pen, you tell me, okay? Can you see it? Yes?
No.
No? Okay.
Not seated.
Okay.
No.
Okay.
No. No.
Okay.
No.
No. Now on the other side. Whenever you can see it, just keep staring at my nose.
No. 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 I did not see it anymore. No. No.
Alright, now we're going to do something similar. I'm just going to have you close your eye again on the side. Okay, stare at my nose. But whenever I get to that field zone, let me know when you see it. Okay, how many fingers?
3. No. Maybe 1. No.
Fingers.
2.
Yes.
No. 1.
Your eye on my nose.
I want to say 2.
Okay.
No. 1.
See it?
Yep. 3.
Cranial nerve 3, oculomotor nerve. The oculomotor nerve moves the eye up and down, medially, and raises the upper eyelid. It also constricts the pupil and adjusts the shape of the lens. This is a motor nerve. This can be tested using the pupillary light reflex, so you have the patient look at a distant object, shine a light rapidly in one eye, and then away. Normally both pupils should be equal, round, and reactive. Another way to test this is the examiner moves an object in the shape of an H and instructs the patient to follow the object with their gaze.
Alright, so now that the lights are dim, I'm going to go ahead and test your pupillary reflex. So I can just have you stare straight at my nose right here. Alright, so what I want you to do is to follow this pin. Okay? Ready?
Cranial nerve 4, the trochlear nerve. The trochlear nerve moves the eye up and down, particularly when the eye is adducted. This is a motor nerve. This can be tested using the H pattern described previously. Cranial nerve 5, the trigeminal nerve. The trigeminal nerve controls the muscles of mastication and the tensor tympani of the middle ear. It also contains the afferents for touch, proprioception, nociception, temperature for the face, and the anterior 2/3 of the tongue, sinuses, teeth, and meninges. It also is involved in the limb corneal reflex. This is both motor and sensory. This can be tested by performing sensation testing of light touch and sharp dull sensory assessment. So you choose a reference point, not on the face, and then ask if it feels the same or different. You can test the motor by placing your fingers over the muscles of mastication and have the patient clench their teeth and palpate the muscles to determine if they're contracting symmetrically. Look for deviations of the jaw when opening the mouth.
Okay, for this next one, I'm just going to lightly touch you on your face if that's okay. Basically what I'm going to do is I'm going to touch 2 points, and I just want you to want to know if they feel the same or different, okay? Same or different? Same or different? Okay, now, I'm going to place both hands on your jaw right here, and I just want you to clench down for me, okay? And then can you open your wide for me? Back down. Alright, open.
Cranial nerve 6, the abducens nerve. The abducens nerve abducts the eye. This is a motor nerve. This can be tested by performing the H pattern as described previously. Cranial nerve 7, the facial nerve. The facial nerve controls the muscles of facial expression and sensation from the anterior superior ear, external ear canal, and taste from the anterior 2/3 of the tongue. It also controls the autonomic efferent to lacrimal, nasal, and salivary glands. It also is involved in the limb corneal reflex. This is a motor and sensory nerve. You can test sensory by testing taste, which is not displayed in this video, and you can test motor by instructing the patient to do the following and document any asymmetries. Raise eyebrows, frown, close your eyes tightly, wrinkle the nose, flare the nostrils, smile, pucker your lips, and blow out your cheeks.
Alright, now I'm just going to test some facial expressions, and I need you to raise your eyebrows for me. Can you blow out your cheeks? And can you wipe your nose? And we got the smile down. Can you frown? Okay. What else am I missing? Flare your nostrils. Wrinkle your nose. Grab your eye.
Cranial nerve 8, the vestibulocochlear nerve. The vestibulocochlear nerve is involved in the sense of head movement, head position, and hearing. This is a sensory nerve. This can be tested in 2 divisions. You can test the vestibular division by having the patient's eyes open, and the examiner rotates the head side to side while observing the patient's focus on the examiner's nose. You can test the cochlear division by gently occluding the auditory canal on the opposite ear by rubbing the tragus. The examiner stands behind the patient and whispers a sequence of letters, numbers, or words, and then repeat on the opposite side.
Alright, for this next part, I just want you to stare at my nose, and what I'm going to do is I'm going to rotate your head side to side and just try to fixate on my nose, okay? Alright, so this next part, I'm going to include one of your ears. So I'm just going to on you. You know what I said?
Blueberries.
Good.
Waffles.
Very well. Got it.
Cranial nerve 9, glossopharyngeal. Glossopharyngeal nerve provides sensory information from the pharynx, posterior 1/3 of the tongue, middle ear, and the area near the external ear canal. It also provides motor function to the muscles in the pharynx. It plays a role in the efferent efferents to the parotid gland and the carotid sinus to control blood pressure and heart rate. It is also involved in the gag reflex and swallowing reflex. This is both sensory and motor. The best way to test for this is to listen to the voice for hoarseness, observe the patient drinking water, palpate the pharynx and control, and use the tongue blade to test the gag reflex.
Okay, for this next one, I'm gonna have you drink some water. And when you do that, I'm just gonna feel make sure.
Cranial nerve 10, the vagus nerve. The vagus nerve senses the pharynx, larynx, and skin in the center of the external ear canal. It is involved in the use of muscles of the pharynx and larynx. It also has control over smooth muscle and glands of the pharynx, larynx, thorax, abdomen, and is also involved in the gag and swallowing reflex. This is both sensory and motor. You can test this by performing the same techniques you use for the glossopharyngeal nerve. Cranial nerve 11, the spinal accessory nerve. The spinal accessory nerve provides motor innervation to the sternocleidomastoid and the trapezius muscles. This is a motor nerve. You can test this by asking the patient to turn their head against resistance while palpating the active muscle. The patient can also be asked to elevate the shoulders bilaterally and apply resistance.
Alright, I'm just gonna test some muscles. So what I want you to do is just copy me. Turn your head down, out, then up. Alright, and what I'm gonna do is I'm gonna push, just match my resistance. You do the other side for me. Then you forward flex your head just a little bit. There you go. Good. Alright, can you raise your shoulders up for me? And back down. Alright. Look just a little bit.
Cranial nerve 12, the hypoglossal nerve. The hypoglossal nerve controls the muscles, the intrinsic and extrinsic muscles of the tongue, and is primarily motor. You can test this by asking the patient to stick out their tongue, and if the tongue has atrophied or has a deviation to one side, it will deviate to the side of the lesion.
Alright, now you stick out your tongue at me. Good. Looks good.